Patients often ask me, should I do PRK or should I do LASIK? It depends. First of all, to be a LASIK patient, you have to pass more tests. So the tests that we do are topography and the pentacam, which will also include the corneal thickness. Patients whose corneal thickness is on the thinner side, or there might be some question on their topography or the pentacam, usually end up having PRK, as PRK is always technically a safer procedure. It's safer because you're not making a laser cut in the cornea. Remember, this is not a bladed cut, but it is a laser cut. And anytime you cut into the cornea, even if it's done under precise terms, you are biomechanically weakening the cornea. So even when you are safe for LASIK, PRK is usually a safer procedure, but there are prices to be paid for both. So if you become a candidate for LASIK because your pentacam is normal, your cornea thickness is normal, your topography is normal, you're the right age, you have the right prescription, you're almost always also a candidate for PRK. If you're told you're only a PRK patient because your cornea may be thinner, or the way that it thickens might not be totally normal, or that there may be something in some of the fan software that we have, then PRK would be your only choice. And then there's still about 20% of people that we turn away, and that should reassure you that we don't accept every patient. So for LASIK and PRK, you are safe for LASIK, safer for PRK. What's the difference? LASIK is the immediate gratification procedure. 99% of my patients go to work out and drive the next day, and they're usually pretty close to 20/20 for distance if that's our goal. PRK patients, even if when we're shooting for distance, usually are in the 20/40 to 20/80 range of vision on day one for distance. Functional, but not usually good enough for driving, or have to be very careful, and usually I tell people in the first couple of weeks to avoid driving. The other part about PRK will work. You're going to have to use steroid drops for a few months, vitamin C pills, and UV sunglasses outside. And day number 3 after the procedure, you're going to want to go home from work early because your eyes are annoying. Having said that, there are many patients now who are safe for LASIK but choose PRK because they are fearful of doing the procedure, and if one procedure is even a little bit safer than the other, they will choose PRK and put up with some of the extra work. I think this is a more than reasonable choice, and we've gotten to a point where at one point, maybe 10, 12 years ago, we were doing 95% LASIK and 5% PRK. We're now doing approximately 50-50 of both procedures. So if you have a screening and you are safe for LASIK and PRK, I will be happy to explain in your particular case what's best for you. If you're only safe for PRK, well, that'll be your only choice, and that's the one you'll have to stick with. So please come in, please talk with me, and we can talk about your unique visual aberrations and what's best for you.